So, colleagues, obviously these briefings aren't as regular now as they once were, given the situation, although things have changed quite a bit since we last updated you on the situation in Greater Manchester. So I'm going to hand over to Sir Richard in a moment just to take you through the latest slides. Obviously, a lot going on the GMP front. Got Baroness Beverly Hughes with us, and Bev will update you there. I'll then just touch briefly on the Joint Select Committee report out today, and we'll say something as well about primary care before we open up to your questions. So without further ado, I'm going to hand over to Richard.
Thanks, Andy, and good afternoon, everybody. If we can get the first slide up, that'd be really good. Just say that we're going to have the normal set of slides, but also we've got 3 more at the end of this dealing with other issues, particularly waiting lists at the moment. This is actually the second slide rather than the first slide, which is dealing with over 60s. And now we've got the first slide. That's brilliant. Thank you. This is the overall case rates. You will see that there has been an increase over the past 7 days, a very significant increase in Trafford, which I'll go into the detail of that a little bit later on, although compared to everything else, the 832.6 figures look somewhat frightening. It's worth reminding ourselves that we have had in Greater Manchester figures of over 1,000 over the period of time, and indeed even over the last couple of months, and we are seeing quite a lot of fluctuation. As always, the big question is, well, what impact is this having on people's lives and on services? And we'll come to that later as well. If we go to the next slide, we're also seeing a small increase in over 60s, substantial figures, I think, for Salford and Stockport. But again, this is an area where we do get quite a lot of fluctuation and where relatively small numbers of cases can turn into quite large percentages. But as always, this is the age group we really worry about, because it's from this age group that if we are going to have problems historically around hospitalisation, ICU and worse, then it's more likely to come from this age group. That's not to the same extent the case anymore, but I'll come on to that later as well. The next slide is the heat map, and this is really quite stark. Clearly, the darker the colour, the more the cases, and you will see black for Greater Manchester against the 0 to 15s, and that's replicated in Stockport, it's replicated in Wigan, Trafford and Tameside. But everywhere else, it is the 0 to 15s where the darkest colour is. Although it's 0 to 15 age group, it is principally 11 to 15s within that age group. So secondary age school children rather than primary age school children. The vast majority of those are asymptomatic. And what we really don't know is the extent to which this just reflects we're testing a lot more than we were doing previously, and testing on a far more systematic basis than we have been previously. You see some places that working age populations, there's been some increase as well, particularly in Trafford, to a certain extent in Tameside. A lot of that will reflect over that period of time that the level of social mixing has just been increasing very, very significantly over that period of time, as has the measures, the reasonable precautionary measures that we keep asking people to take, particularly wearing masks in crowded places. We're increasingly seeing that that's just not happening at all. Again, largely asymptomatic and largely not ending up in hospitalisation. Move to the next one. Care homes, a very stable position here. I think this reflects we now have a very high proportion of care home residents that are double jabbed. and we will have most of them with a booster jab, or at least we'll be offered a booster jab over the coming few weeks, really. Really important about care homes that we're also now getting in some of the districts, over 90% of staff have had at least their first jab, so care home staff are also going through the vaccination process quite successfully. And for care home residents, that in terms of mortality rates, they are now pretty much negligible, really, that vaccination is really having an impact. And move to the next slide. So hospitals, we see, not surprisingly, that there's been a slight increase in hospital admissions and diagnosis, small increase in the number of beds occupied, although that has, particularly for the ICU beds, been fluctuating up and down at more or less the same figures now for something like 7 or 8 weeks. It's not really changed very much. It's worth saying about ICU, well, all of the COVID cases really, the impact on other hospital services. I've seen examples recently where a drop of 2 COVID cases in ICU in a particular hospital increases the availability of ICU beds for other patients quite significantly, because it's worth remembering that you only need 1 COVID positive patient in a ward, and you can't use it for anybody else other than COVID positive patients. So you take quite a lot of capacity taken out by a relatively small number of patients across the system. If we move on to the next one, I think this is the last of the normal slides we occupied. A number of things to say about this. We are doing relatively well with the most vulnerable groups. Probably by the next time we show this slide, we'll have a third column which will be showing boosters, again, particularly for the top four groups. It's got a statistic from Public Health England earlier today about the impact of vaccination, which is very, very stark, and not on the biggest sample in the world, but since we have been able to have people double vaccinated, so not from last year, from this year, look, an examination of who has died from COVID shows that between 98 and 99% of people who've died are either not vaccinated at all or have only had a single dose. So the impact of double vaccination has been absolutely enormous on mortality rates from COVID. Really, really important to get that over. Basically, double vaccinated people might get ill, but they don't die. That's a pretty good reason to go and get vaccinated. If you look at the 18 to 49 figure, is still going up slowly, but let's make it clear for that age group, vaccination is still available. So if you've not had one, go and get one. The priority at the moment for who we are really trying to target are people for the booster jabs, really, really important, and of course 11 to 16-year-olds in school-aged children as well. Which now go to, I think, the new slides we've got, which got rather more words with the data hidden between them. But this is talking about waiting lists. There is hard evidence, very hard evidence, just the numbers say that Greater Manchester, along with adjacent bits of East Lancashire, have been the hardest hit areas by coronavirus. Quite stark in terms of the figures, but it doesn't really matter where you are because of the amount of capacity that's been taken to deal with COVID, that we have now got increases in the number of people and the length of waiting for elective care. A lot of this is because people have been delaying seeking treatment, or now seeking treatment. Indeed, it's not published yet, but the most recent survey carried out by Greater Manchester, which on every previous survey has shown a significant proportion of people delaying going for treatment or delaying going for diagnosis now shows nobody delaying their treatment. People are now coming, but that means that there is a backlog. And when we're talking about waiting lists, we're not just talking about waiting lists for operations. We are talking about diagnosis. We're talking about medical treatments as well as surgical treatments as well. It's the whole lot. Number of people waiting, so it's gone up, but waiting over 52 weeks, and the biggest target is waiting over 104 weeks has reduced. NHS use particular timescales for measuring how long you've been waiting. There are clearly some people that it's basically 72 hours, or i.e. almost immediately for operations, through to 1 month, through to at the other end 104 weeks. Most of us call it 2 years, but the NHS call it 6 to 104 weeks. It will take time to recover. And we don't have additional capacity to deal with these waiting lists, but there are elective recovery programs in place, and we are working through those backlogs. We've identified 3 specialities with the biggest number of over 52-week waits that are identified here: orthopedics, general surgery, and oral surgery. I probably can't repeat this often enough, is that delivery of elective work is still being constrained by COVID, largely for the reasons I gave previously. Plus, of course, we still do have staff having to self-isolate as a result of COVID as well. If we go to the next slide, and this starts to deal with some of the things we're doing about it. The first is that if people are waiting, you get anxious. Obviously, you want to know what's happening and what you can do about it. So we've developed a website that allows people to get advice, including, of course, advice if you think your condition is deteriorating, what you should do about it, because we don't want that. New ways of providing treatment. Walk in, walk out, ENT at Royal Manchester Children's Hospital. Instead of taking bed time up, and this is applying to other same-day treatment has now become more common. It is really being able to use the resources we've got efficiently. An orthopaedic hub established at Wrightington Hospital, a specialty of Wrightington, and that's allowed additional theatre sessions. See, super Saturdays at Fairfield Hospital is really just using Saturdays as an intensive day to get through lots and lots of hip and knee surgery. And whilst things like hips and knees are quite often seen as low priorities, that if we want to take a preventative approach, which we do, and we want people to be able to live independent lives as fully as possible, then these are sort of operations that the quicker and earlier people get them, the better, because they are less likely to deteriorate, more likely to be able to live that independent life. We've set up 2 community diagnostic hubs in order to be able to give better access to diagnosis. There are going to be more of those on the way as well. The final point there is that, penultimate point is making sure we get the referral service right, so the right people are referred to the right place at the right times. The very last one is really important. We now have all of the Greater Manchester system basically operating as one for a lot of this work. So you might find, for example, with Wrightington, that there is one particular centre that is doing work for the whole of Greater Manchester. There is a risk there that could heighten, I think it's what's described as geospatial inequalities. I think postcode lottery is, again, what we probably more normally refer it to. So there's a lot of work to make sure that we understand who needs treatment, what the clinical priority is, and to make sure that wherever people are from Greater Manchester, wherever it is that they're having the treatment, they do get it in that order of clinical priority. And I think that probably, just one, it's not on here, but there are also examples really of how we can improve efficiency. And an example I think was given yesterday was where with one surgeon basically operating from 2 operating theatres with support teams in both. which meant that the surgeon was effectively to spend their full working day doing operations, not waiting for a theatre to be cleaned down in between different operations, and that pretty much doubled the number of operations that that one surgeon could do. So lots of innovation taking place to try and find new ways of bringing waiting lists down, and we have made proposals to government about how largely through capital investment we will be able to accelerate bringing the elective waiting list down even more, and at the same time provide in the long term better services for all patients. The very last slide is basically, this is the homepage for the new website, which obviously we want to promote, because there are a lot of people waiting, far more than anybody would want, and we want to try and give people at least a route to be able to access support easily in their own space. Clearly, not everybody can use website services, but most people can now, and this is a really useful tool to be able to help people. Perhaps the last thing I'll say, Andy, I know I've gone through a lot today and probably been a bit longer than I normally have, which is just to repeat something I said over and over again. Because people that were deferring treatment aren't anymore, because all of our services have to operate in a COVID-safe way. So, for example, in dentistry, the number of patients that they can see in a day is massively reduced. The whole system is under pressure, and we really do need to keep getting that message out, is that for people who are anxious, that colleagues across the health and care system are doing the best they can in very difficult circumstances, including all the innovations that I've been talking about this afternoon. Thanks.
Well, thanks very much, Richard. A very important update. And just to echo your last point, it's very, very tough for colleagues in the NHS right now. And I think we all need to bear that in mind. And there's a feeling that they perceive the world to have moved on in the media, when actually the reality remains a very difficult one for staff in the NHS, and will be through the autumn and winter. I think we all need to bear that in mind and continue to support them as best we can. So with that, I'm going to turn to Bev for the GMP.
Thank you very much, Andy. I thought I'd just touch very briefly, first of all, on the overall situation, COVID-related and staffing situation that affects the operational activity of GMP, and then say something specific about the current levels of public concern around the Wayne Couzens case and the concern about police sexual misconduct and so on, because we've been doing a lot in that area. So on the overall operational picture, it is an improving picture. Certainly in terms of the impact on the workforce of COVID infections, the need for self-isolation and so on. We've seen a big reduction in the number of staff who are self-isolating, down to about 35 compared to a peak of 200. And that's also reflected in the kind of situation crime-wise, really. If you remember, in terms of the pattern, crime levels across the piece fell really during the COVID lockdown periods, and then as people came out of lockdown, there's big resurgence in levels of all types of crime. That's really now stabilised across the piece. There's two particular things the Deputy Chief Constable alerted us to at the meeting this morning, and one was the substantial increases in domestic violence and domestic abuse. Year on year, if you compare to last year, although it's been fluctuating, the underlying picture is one of substantial increases. And secondly, the very significant number of deployments the police are making to incidents that have a very distinct mental health element to it. And again, I think we all think that that is definitely COVID related and reflects the situation. So the overall picture on operations, I think, is that after a very intense period in the summer, affected by reduced staffing because of the infection, and at the same time increased levels of criminal activity, that is now stabilising somewhat. So that's an improving picture. Just something specifically on the call handling and response. Again, we've now, you recall that the HMIC did a recent visit and found issues there. We've now got 77% of 999 calls are being answered within 10 seconds. The national target is 90%, so we've still got a way to go, but it's moving very, very strongly and quickly in that direction now, and I'm very pleased about that. We've got a new Chief Superintendent, Chris Gibson, who's been appointed from Merseyside, where he's led a very successful command and control operation, and he's started now. We've also now appointed another 40 call handlers. That brings the total to over 230, which is an 18% increase in the staffing in the OCB. And although it's work in progress, that staffing is helping to improve that situation there. So just touching on, obviously, the very high levels of public concern about policing here and across the country as a result of the Wayne Couzens trial and his sentence following the murder of Sarah Everard. And that's really heightened and made a resurgence of people's concern, hasn't it, about sexual assaults, domestic violence and abuse, and about police officers, other members of police services using their position for sexual purpose. I think I just want to say that we have been working on the whole area of gender-based violence for some time now, and you'll recall that earlier this year we brought forward the launch of the Greater Manchester Gender-Based Violence Strategy in response to that work and in response to the Sarah Everard murder. It's because that it's such a high priority for us that we've been working on measures that do relate to this issue. Our starting point for that strategy and for all the work that will flow from it is that violence against women and girls is not an issue for women and girls to tackle. It's an issue for men, it's an issue for the police and the criminal justice system, for other public and private agencies and for the public themselves. And I'm really pleased that the Mayor has committed himself to leading a campaign, particularly in conversations with men and boys, to address this issue. It's also it's good today to be able to announce, in a sense, one of the first next steps in that strategy, which is having been awarded £550,000 by the Home Office. We're able to initiate some pilot interventions which reflect many of the issues that women and girls told us about in terms of their safety when they're out and about in the streets and on the transport system. And that money will be used to pilot some interventions around those issues, around transport and safer streets. We'll be evaluating those interventions, and where we can see that they're successful, we'll be scaling them up ourselves as part of the implementation of that strategy. As I said, because of the work we've done developing the strategy, we've also been addressing some of the issues which are important here. So for some time now, for probably 18 months, I've been leading a very close look through the local criminal justice board at how we deal with rape cases. We regularly now have deep dives on rape cases that jointly with the Crown Prosecution Service and the police to learn lessons and disseminate good practice. I've established a rape strategy group. In terms of police misconduct, I have for a long time received a detailed report from the Professional Standards Bureau on all the cases they deal with, and I meet with the leader of that bureau. And then thirdly, we are returning to having specialist teams on every district. You'll recall that the previous leadership disbanded the specialist centralised unit for dealing with rape and serious sexual offences, and dissipated those people to the districts, and that there weren't therefore any longer any specialist teams. There was a single so-called RASO officer, rape and serious sexual offences officer, on each district, but that is all. We announced over a year ago extra funding in the budget for another 230 officers to form a strengthened safeguarding capability across GMP. And those additional officers will be used to provide a specialist team one for children and young people safeguarding and one for adult safeguarding and addressing rape and serious sexual assaults and domestic violence in every district. It's work in progress. We've got the money for it. The officers are being appointed, but there is a transitionary period before we get to that position. But that is the objective, and I'm really very pleased about that, because I do think this needs a specialist capability to deal with those kinds of very sensitive cases. And then finally, just very specifically in relation to actions that have been taken in the last 2 weeks in respect of the Wayne Couzens situation. On misconduct and disciplinary hearings, there's an absolute priority in Greater Manchester in dealing robustly with any cases of abuse of position for sexual purpose. You'll have seen in the press recently reports of 158 such cases of sexual misconduct by officers over the last 5 years. Just to give you a bit of context for that figure, I would say that a very significant proportion of those cases come to light because of systems that the police have in place internally to be able to identify the way in which officers may be handling cases which are of course of concern or are being reported by other members of the police service. So some will come from members of the public, but a significant number come from those internal systems to capture activity of concern and from internal reports from other officers. So, I just wanted to make that point because it does really show that not only is this taken extremely seriously, there is a proactive endeavour to root this out, to identify it rather than wait for it to be reported. And that is reflected in that number. Secondly, also developing relationships more recently with organisations that provide us with independent sexual violence advisors and domestic abuse advisors, voluntary organisations working with women who've been sexually abused so that they can have direct lines of communication with the police to alert them where they've got concerns about the way a police officer is handling something. And then finally, just on vetting, which is the other part of this system, obviously that's of concern after Wayne Couzens, the Deputy Chief Constable has initiated a review both of the process of vetting and the resources that are needed to ensure that vetting can take place in a timely way and we don't have long backlogs of officers who haven't been vetted who will have started work. So that's a summary of where we are, but I did want to say that abuse of position for sexual purpose is an absolutely heinous offence. We will not tolerate that in any way at all, and quite the opposite. Not just tolerate. We will actively pursue any behaviour that raises those sorts of concerns, root it out, and deal with it as robustly as we possibly can. Thank you, Andy.
Thanks very much indeed, Bev. And colleagues, just 2 things from me before we open up to your questions. The first is on the report today, the joint report from the Health and Social Care and Science and Technology committees on coronavirus and the lessons learned so far. Just to say that we welcome this report, this joint report from the 2 committees, because it validates concerns that we were raising via this briefing over the last 18 months, particularly the handling of the Tier 3 situation this time last year. Now, I don't intend to rake over those coals today, but as Sir Richard said earlier, the evidence is now clear that we have been harder hit by the pandemic than other parts of the country and not helped by some of the decisions that were made at a national level. That has led to our health service to be more disrupted than other parts of the country, our schools and our young people to have their education more disrupted than in other parts of the country, and also greater damage to the economy. We were given a figure today at our emergency committee that the claimant count in Greater Manchester is still 50% higher than it was at the start of the pandemic. And obviously we've had a very challenging climate in which our businesses have had to operate over the last 18 months. So looking forward from where we are, it's why we are kind of putting forward that notion of a levelling up deal for Greater Manchester to help us move quickly into this recovery phase and to get the economy going and get the sense of optimism going in terms of the possibilities in front of us. And we put forward that deal to the government last week. There are strong components around public transport, brownfield housing, skills, research and development. But as Sir Richard has indicated today, there is an important NHS and social care component to that as well, as part of the spending review, which will come 2 weeks tomorrow. So we think this is a very critical moment for the country as we look to level up coming out of the pandemic. The bid is in. We believe it offers a really strong way forward for the government, whereby we will take on responsibility for delivery, and the government can hold me and other leaders to account for delivering. And we think this will move the country back together in a more unifying way coming out of the pandemic, and we hope it will receive a favourable hearing from the government. Just to say something, if I can, before finishing, on primary care, because since the last time we were able to brief you, you may be aware of a very serious violent assault at a GP practice in Manchester against one of the GPs who suffered serious injuries, but also it had a terrorising effect on the staff. And it's not the only incident. We haven't seen one of that seriousness anywhere else, but there have been other incidents where we've seen levels of abuse or worse, intimidation aimed at staff being way beyond acceptable levels. And we are conscious that this is a very difficult time for colleagues in primary care. I've written to all practices in Greater Manchester to assure them of our ongoing support, to provide some reassurance. But I just thought it might be worth updating you on the latest position with regard to primary care in Greater Manchester, so that there's no misunderstanding, because I think there is in certain places a lot of unfair focus being put on primary care, and maybe perhaps the true position is not fully understood. The latest figures that we were given this morning say that around 55% of all consultations in Greater Manchester are face-to-face. And the reason why we can't move back to a full face-to-face scenario is firstly because of the figures Sir Richard gave us at the start. Case numbers are still high. So from an infection control point of view, it's not safe to move back to a full face-to-face service. But also it wouldn't deal with the level of demand. And it's important to maintain a digital or a telephone consultation service to get through more demand, given the pressure on the system. So there are very good reasons why primary care is operating in the way that it is right now. Now, no one says that it's perfect. It's a case of we are where we are. And it's just to provide strong support from our level to colleagues in primary care, working in GP receptions, practice nurses, practice staff, and of course GPs, that we are fully behind them and supporting them through what is a really difficult period. And we think some of the media coverage has been unfair. We recognise there is more that should be done, if you like, to keep the situation under review and improve the way that primary care are handling these things. No one's saying it's perfect, but I think it's very important for me to be able to say today that we think colleagues are doing a really good job in very difficult circumstances. They've got our full support, and we hope the Greater Manchester public will understand why the service is currently as it is. So with that, I'll leave it there, Jimmy. We'll take questions now. Appreciate we've tested your patience a little bit, colleagues, but I'm sure you'll agree that with the 3 updates you've had, there are some big issues there that needed to be fully explained. But with that, Jimmy, I will hand back to you.
Thank you very much. If colleagues from the media would like to raise your hand if you have a question, I'll give it a moment for journalists to do that. Thank you very much. So the first person I'll allow the microphone for is Helena Vesti. Helena, you should be able to unmute yourself now. Introduce yourself, please, where you're from, and ask your question.
Hi there, my name's Helena. I'm from the MEN. I'm the health reporter. I've got a couple of questions, firstly on the situation in Trafford and then on care homes. Are we expecting stricter rules in Trafford? Obviously, Sir Richard mentioned that it's difficult to turn back the clock now that people have gotten used to being more relaxed. And will those kinds of rules be extended across Greater Manchester? Also, we're obviously seeing that the majority of, or rather a large number of the people who have been affected by this rise in COVID cases are young people of school age. Are you seeing a trend in terms of the number of children testing positive and then those being hospitalised? Secondly, on care homes, Sir Richard mentioned that there's about 10% of people of care home staff who haven't had a first dose yet. Can the care home system in Greater Manchester cope with that once November the 12th rolls around? Thank you for allowing me the time for questions.
Thank you. Andy, would you like to address either of those, or are they for Sir Richard, do you think?
I think they're for Richard, Jimmy.
Thank you. Richard.
Myself, I think first of all, if I start with the Trafford position, and basically what they are doing, health official, public health are working very closely with schools. This is principally a schools issue within Trafford to make sure that people are safe as possible. They are looking at measures like advising to wear face coverings when moving around school. Parents, when they're dropping off and picking up, are being asked to wear face coverings. They are looking at where somebody lives in a house. Most, by the way, most transmission is now in home settings rather than anywhere else. But for pupils who have got somebody in their home who has tested positive, to do daily lateral flow tests before going to school, because clearly we want to try and keep people in school, and for that testing to continue for a period of time. Lots of communications generally within the community about getting vaccinated, wearing face coverings, fresh air, keeping windows open, washing and sanitizing, and getting a test if you don't feel well. I think those measures, believe at the moment, are probably sufficient to contain as if people abide with them. And so there is quite a lot going on between public health and schools to try and improve the situation there. It's not, so a lot of this is cases that are asymptomatic. It's not turning into massive hospitalisation, but they are aiming to bring it under control. As far as care homes are concerned, I think we probably appear to be passing a threshold where that we do think the care home sector will be able to cope because of the number of people who are now getting vaccinated. So clearly staffing in care homes is always a cause for concern, but we will keep very close to it. Social services still maintain very regular contact with all of their care homes. The community cell in Greater Manchester still has very regular weekly reports of what's going on in the sector, and also care homes identifying when they have got problems. All of that will continue, and undoubtedly will continue right through the window. But do believe that at the moment the position is likely to be sustainable.
Thank you, Richard. The next person who has a question is Leisha McNally. Leisha, you should be able to unmute yourself now. If you just introduce yourself and where you're from and ask your question, please.
Hi, everybody. This is Leisha McNally from Granada Reports. Andy, I wanted to ask, we've seen the situation in Trafford, and this report out today, which you mentioned, has been very critical of local lockdowns, says they're confusing and nowhere near watertight enough to prevent infections from spreading. What do you think the learning should be going forward if more measures are needed?
Well, thanks very much, Leisha. So the report is pretty damning, actually. So just to read paragraph 124, page 49, it says, from the evening of March 23rd onwards, it's talking about the rules. The comparative simplicity with the rules were replaced by a complex, inconsistent, shifting, and scientifically ambiguous set of detailed regulations. And it goes on to say that the situation in Greater Manchester brought that to a fore. It bears out what we were saying, you know, and we heard this actually in some of the expert advice that we were given this time last year, that Tier 3 was unlikely to contain the spread of the virus. So we were confronted with a situation where we knew Tier 3 would cause certain damage to our economy, but without necessarily having the health impact that was being claimed, and hence the position that we took on it. So I would say there are a couple of things from here, Leisha. First, that we don't want to see any return to local lockdown. You know, the situation of last autumn was replaced by the tier system that we had at the Christmas period, and you know, the evidence was that people were travelling to get to areas where hospitality was open. I mean, it just didn't work in terms of containing the virus, and we went, as you'll know, into another national lockdown early in the year. The second thing I would say is we also now need to see more responsibility vested at the local level. You know, we've had a discussion this morning about the situation in schools, given the figures that have just been given, and we believe it's for directors of public health at a local level, working in consultation with schools to take decisions that are right for local areas. And there is still some national interference in that decision-making process. So, you know, no return to local lockdowns. If there has to be, you know, drastic action taken, then we would say it's got to be done at a national level. Support the to support directors of public health working with local partners to get decisions right for local areas. And the last thing I would say is, you know, bring sensible measures back should they be needed as we go through the autumn and winter period. And I'm talking there about preventative measures such as face coverings on public transport, for instance, in enclosed spaces, a return to sensible distancing. Because there's a point that needs to be made here, Leisha, if I can, which is about how different the winter coming will be from the winter just gone. The winter that we've been through 12 months ago was very much about COVID, where COVID was the concern. That's where all of the focus was, and we had obviously much bigger numbers of people in hospital at that period of time, in both general beds and in critical care, who were COVID patients. That's not the same now, and it's unlikely to be the same this winter. The difference about this winter is everything else that was held back last year will be coming back with a vengeance. So I'm thinking about the seasonal flu, norovirus, a whole range of seasonal conditions that we experience every year are likely, listening to those in the know, are likely to come back more strongly. And in fact, there's already evidence that there is more circulating, more other viruses that are not COVID are already in quite wide circulation. So the sensible measures that we might take around wearing of face coverings and distancing will protect people more broadly from the wider range of things that is likely to be around this winter that were held back over the last winter period. And I think that's just a really important message to get out. You know, obviously protect others, but protect yourself as well. You know, this is going to be a challenging period for everybody. So those are the things that I would say. No return to local lockdown, support directors of public health, and consider preventative measures when they are needed.
Thank you, Andy. We've got a next question here, but I should say this is the final question currently from members of the media. If you have a question, if you'd like to raise your hand, and we'll try to come to you in the time available. But this is Jessica Hay. Jessica, you should be able to unmute yourself now, introduce yourself, where you're from, and ask your question, please.
Hello, it's Jessica from Manchester TV and Manchester World. To Andy, on vaccinations and young people, 7 out of 10 Greater Manchester boroughs are below the national average for vaccinating those aged 12 to 17. Is that a concern, and do we have to leave that down to parental choice, or do you think there's more work that needs to be done around that? Thank you.
Well, thanks, Jessica. Maybe Richard also might want to comment on this. We haven't yet been presented with, if you like, very high quality data in this area. It's still very early days, and so the committees will get the first sort of reliable data probably when we meet at the beginning of October. But obviously we have had some anecdotal feedback today. One of the issues, it's not so much about parental consent. It's one of the issues is because of the high case rate amongst the age group that you mentioned, there is then a complication with vaccination because people can't be vaccinated within 1 month of having had a positive diagnosis of COVID. So that is having an impact on the rollout of the vaccination programme in schools. What we would say to people is, you know, it's about protecting the entire household going through the winter, because as Richard said, there is evidence now in the figures in the heat map that you saw that the higher case rate amongst that school age group is then leading to household transmission amongst people aged sort of 30 to 45, obviously their parents. So it's about keeping everybody safe this winter, and it's really important that when people can take that vaccine, that they do take that vaccine. And that very stark figure given around hospitalisation and death from people who haven't had the vaccine or have only had one dose is there, and it obviously needs to be very, very carefully considered. So, you know, we would like to see a higher take-up rate amongst the adult population, particularly younger adults. But this is an area where we will be giving plenty of focus in the coming weeks, and the work is ongoing, Jessica. But you know, we will obviously be continuing to get the message out, and we think this is an important part of winter planning. But I'll hand over to Richard. I'm sure Richard might want to add to that.
Just one thing to add, really, is, and this is the staffing side of doing the school vaccination programme, where we are restricted at the moment on which staff we can use for school vaccination programme. That's limited the numbers, so we are seeking to be able to use a broader range of staff to do school vaccination, which I think would allow us to catch up on our numbers.
Thank you, Richard. And as things stand, that's the final question. So, Andy, if you have anything you'd like to say to conclude today, and then I think we might be done.
Not particularly, Jimmy, because obviously we've spoken at length and we needed to provide a fairly full update, but there was a lot to touch on. So no, thank you everybody for your attendance today, and we'll have the next briefing. It'll be on Tuesday, the 9th of November. So you know, we are always grateful for your attendance. I think it'd be particularly important that you come to that one, just because we'll have a clearer sense, I think, by then of how the winter period is shaping up, and we'll have new figures, as Sir Richard said, on levels of take up of the booster, and hopefully figures that we'll be able to give you then on school vaccination. So thanks everybody. I don't know if Bev or Richard have anything to add. No,
Not from me, thank you.
Great stuff, and we will see you all in a month's time. Thanks everyone. Thanks, Jimmy.
Thank you.